An aerial shot of a highway and monument in the city of Mataram in West Lombok District, Indonesia. Black text on yellow screen reads, "Over the last decade, Indonesia has reformed its national health insurance system to provide healthcare coverage for all Indonesians. However, Indonesians with disabilities still don't have equal access to healthcare." Sustiarini is a 37-year-old woman with a disability and a mother of 4. When she first applied for mandatory health insurance as an individual payer, she was charged $8 a month by Indonesia's Healthcare and Social Security Agency, BPJS. With no steady income, she struggled to make payments. Sustiarini, wearing a pink shirt and a patterned hijab, speaks to camera.
Di tahun 2013,
In 2013, I made a BPJS independent card by taking class 2.
dengan mengambil kelas 2.
Video of the exterior of the West Lombok Public Health Office.
Angsurannya itu 40.
The installment was 42,000. At that time, my husband and I and my third child were included in BPJS independent.
Black text on yellow screen reads, "Eventually, Rini stopped making payments to BPJS. Everyone in her family was healthy, so she didn't see the need for health insurance. Then, one of her children became sick, and she had no way to pay the hospital bills. Cars passed by on a tree-lined street in Mataram.
Di tahun
In 2015, my first child was sick and needed hospital treatment.
dan membutuhkan biaya perawatan di rumah sakit.
Black text on yellow screen reads, "Rini applied for free healthcare known as PBI. She was denied for several reasons."
Tapi pihak dinas
The Mataram City Health Office explained
menjelaskan
that for 2015, there is no program for PBI in the Mataram City area.
program untuk PBI sendiri di wilayah Kota Mataram.
Rini walks toward the front entrance of the Regional Health Laboratory. Black text on yellow screen reads, "Because Rini had stopped making payments to BPJS as an individual payer, she also owed the government money. She was told that until she paid off her debt, she would not be eligible for PBI." In June, the Disability Justice Project visited the West Lombok District Health Office, where Nurse H. Zulkifli, secretary of the office, explained that Rini was mistaken. The health office had changed its policy in 2020. Now anyone who needs free healthcare can receive it whether they owe money or not. A sign for the West Lombok District Health Office on the side of a busy street. Zulkifli sits in his office speaking to camera.
Menjawab pertanyaan
To answer your question earlier related to the BPJS PBI program in West Lombok, it is a form of presence and support by local government for the people of West Lombok.
kepada masyarakat Lombok Barat.
8 people meet around a long table at the health office.
It is recorded that she has a lot of debts and unable to pay them, but when she is sick, needs financing, needs service, she is accommodated. She can be transferred. Her status does not require her to pay the debts first, but is still being considered as debts.
Informational posters in the health office.
Itu
This is when the regulation came to allow it. We have done that since 2020. People who used to be independent payers, although having debts, due to not paying the premiums, we can still serve them.
lunasin itu boleh kita nanti jadwal.
Rini sits down at the front desk of the health office. Black text on yellow screen reads, "Now Rini and other West Lombok citizens are in the process of applying for free healthcare." Rini speaks to camera, smiles, and gives a thumbs up.
Senang dan bahagia.
I am very happy because I can get BPJS PBI without paying arrears.
Bayar tunggakan.
Text on black screen reads, "Copyright 2022 HWDI, all rights reserved." Made with support from the Disability Justice Project and the Disability Rights Fund.